What are the key things that happen in this bill, and how is it supposed to actually combat inflation? In today's video, we'll answer those questions and more when we, of course, break down the Inflation Reduction Act. So in actuality, the Inflation Reduction Act targets inflation in two places. Okay, so it's lowering the cost of healthcare. That's price, right? So we're lowering inflation by targeting lower prices in healthcare. Now, healthcare isn't one of the major components that's driving the cost overall of what the Americans, or at least the CPI, would indicate as a major target, but it was already kind of in this Build Back Better bill. So this act, the Inflation Reduction Act, is kind of like a stripped down, repackaged version of the Build Back Better Act back from, when President Biden first was elected into office. So that's kind of why it's still here. It does actually target the price of consumer goods, namely medical, and that's why it's still here. Additionally, the ACA, the Affordable Care Act, and all the healthcare.gov in healthcare exchange, where most self-employed individuals and those individuals who aren't getting their work or getting their health benefits from work or from Medicare, the ACA subsidy was increased. So that's how they're going to target inflation. That way, by making healthcare, less expensive for consumers, as it was going to go up quite substantially for a lot of Americans, 13 million Americans, in fact, in 2023. Additionally, they're going to target energy. So this is kind of where I see the Inflation Reduction Act kind of having some, positive effect by increasing the production or acceleration to get away from fossil fuels. We are actually pushing more money into solar, wind turbines, batteries, infrastructure, and we're pushing more, you could call it, tax incentives, tax credits for people who are buying into these products, namely EV and clean energy vehicles. So that's how we're targeting inflation from those two key points, from the medical price and from the price of energy, gasoline, price of oil, right? That's been really hurting our products. If you look at the CPI data, a lot of the CPI index has been attributed to like a 40% increase in the cost of energy related goods. And also the supply chain does get affected pretty heavily when the cost to move things, from transfer things to the port, transfer things overseas to America and then into the continental America, or into the, from the harbor to the store, the prices of that obviously have gone through the roof, with gasoline, going up 40%. So that's the government's kind of way that they're going to reduce inflation. Again, this next part of the bill is going to help pay for this bill, but I feel like the next part of the bill might actually kind of negate some of the inflationary components, of the savings for this bill. So we're kind of attack it from one area and then give back in another. So how are we paying for this bill? Well, the major thing that they're using to pay for this bill is implementing a 15% minimum corporate tax on corporations that make $1 billion or more. Now, there's an article that I'll put down in the description that kind of talks a little bit about how that's different from the kind of old corporate minimum tax. They use it's the way that they classify certain terms and certain deductions you can take. So it's not like the corporations never had any kind of minimum tax. It's the way that they calculated the amount of tax that the corporations would pay is now going to use a different kind of metrics based on their financial statements versus kind of like their tax filings that they were doing. There were two different, you could call it two different ways that they were classifying or reporting their income and expenses. So that's kind of changed. I'm not a tax person, but you can read more about it if you want to learn more about the actual details of how that part plays out. All right, so the nitty gritty. So we'll start with Medicare first. So the way that this bill is helping Medicare is that they are effectively allowing Medicare Part D to negotiate prices on Medicare Part D drugs. And this, I talked about this before, it's good for the consumer in the standpoints that it'll save money their pocketbook, but as far as innovation, pharmaceutical companies have gone and said if this bill passes, we will lose out a lot of the benefits of spending an absorbent amount of money in research and development, and thus bringing new medical technologies to the marketplace faster and more accessible to people on Medicare. And that's kind of the give and take there. Do I think that the pharmaceutical industry will still make a lot of money? For sure. Will it hurt the customers? Who knows? But it is good because currently there is, of course, Medicare Part D has no ability to negotiate the super high expensive medications. Additionally, this is the one thing that I think will at least make the Medicare Part D space easier to navigate is they're plopping on a $2,000 max out of pocket for the Part D drug plan. Now, I don't know how they're going to change the Part D coverage. As you know, if you've seen any of my videos talking about Medicare Part D, there's 4 parts of it. There's your deductible, initial coverage phase, coverage gap, and the catastrophic phase, all within a Part D plan. And now they're stacking on a $2,000 maximum out of pocket. So how that is going to kind of mesh with the current structure of the Medicare Part D, I don't know. Again, with the fact that this bill passed now, obviously Medicare Part D drug plans aren't going to have this in their contract for 2023. So we'll see what these drug plans look like in 2024, 2025, whenever I guess this legislation is going to be, when the law will actually take effect. Next, the ACA. So before we had the CARES Act, the CARES Act expanded coverage to people who are buying healthcare from the healthcare exchanges. Initially, you could only get subsidies to help you pay for your really expensive health insurance if you made underneath 400% of the federal poverty guidelines in your state, you typically. And that's not enough. I'll be honest, that's kind of steep, because if you make 401%, you have no access to any subsidies. You pay full price for your health plan, which can be very expensive. For someone like me who is 37 male, a platinum plan would be almost $700 a month. And that's a lot of money, $700 a month. So what the what the CARES Act did was expanded the coverage to not be based on some kind of a FPL level. They decided to base it on your income. So long as you were making, or your health plan was more than 8.5% of your take-home income, or actually it's not your take-home, it's your gross income, then you are able to qualify for some help to push your health insurance to be no more than 8.5% of your annual income, which definitely is a little bit better gauge in my opinion, because if you've seen some of my last articles or videos that I cover, the ACA plans on healthcare.gov are expected to go on average 10% higher in 2023. Now again, there is a range, but that means some plans will be 15% more than they were last year. So shopping for coverage this year is going to be very, very important. And you can check on my website and on, of course, this channel for more information and more how-tos on how to really shop and find the best plan for you. But for the sake of this video, just know that 8.5% income cap is going to be in effect, and it's going to continue on because of this bill. So how are the energy prices going to come down? Well, this is what the bill has. So we're going to be investing in clean energy in both facilities, infrastructure, and by providing tax credits for consumers. And they're doing this by extending or expanding their tax credits for electronic vehicles or clean energy vehicles. If you buy a used vehicle, that's EV and clean energy, you can claim up to a $4,000 tax credit. And if it's a new one, you have a $7,500 tax credit. And there's $9 billion into this kind of tax credit fund. Additionally, $30 billion is going to the kind of production of solar panels, clean energy, type of infrastructure for the US. Another $10 billion is going to facilities that produce or manufacture clean energy technologies like solar panels or EVs. Another $20 billion going toward rural communities that practice climate smart agricultural practices. That includes things like planting fire-resistant forests, reforesting some areas, and adding, forests or planting trees in urban areas. Additionally, they're going to impose a $1,500 per metric ton on oil and gas companies for methane emissions, and it's going to reinstate oil and gas lease sales in the Gulf of Mexico and Alaska. So there you have it. The bill pretty much goes and saves money on prescription drugs on Medicare, some health insurance premiums for those people who are on the Affordable Care Act, healthcare.gov, health exchanges, and also we are moving away from oil and moving toward clean energy. I hope you learned a lot from this video. We'll see you in the next one.